Hello and welcome to EchoMap, the GP's practical, easy and above all useful ultrasound tool. The site where we talk about real, authentic, clinical cases from real life, from a real GP consultation, with images that aren't always perfect like in books, and that's okay since this is real life. And you'll rarely be confronted with such typical images as in the books. So today I'm going to lie a little bit since, for kicks and giggles, the images are going to be pretty close to what you'd find in the books. I'll leave it at that. If you like this channel, subscribe to the channel, put me a like, put me your comments. It's always a pleasure to read you. Plus, it's very encouraging. And that's why, once again today, I've taken some time after my consultation, after seeing this clinical case, to summarize it for you in video. Because I thought it was interesting to share the images with you, which are very beautiful and help you progress, you like me. Same on Facebook, put me a like, subscribe to Facebook to be kept informed when new videos are released. And as I make this video, well, your ultrasound training is still offered. An introductory ultrasound training course to help you get started, to get your foot in the door, because I guarantee it will be of enormous benefit to your patients. And to join us, well, the link is in the description as usual. The clinical case, this is a 36-year-old obese patient who comes to see me because she's experiencing chronic pain in her right hypochondrium. We've told her about the gallbladder, obviously, and she'd love to know a little bit if there's any concern. So, chronic pain, constant, not very intense, but daily, sometimes peppered with more intense and more significant pain that can persist for several hours after feeding. So it was still overall quite suggestive and indeed required an ultrasound. So, we'll start by scanning this patient's liver. No really marked steatosis. A discretely echogenic liver can possibly be seen here in relation to the kidney, but nothing too obvious. An echo structure of the liver that is absolutely correct. We're going to measure the right hepatic arrow. No hepatomegaly, 128 millimeters is just fine. So, there weren't any very surprising things in terms of steatosis or the size of his liver. Eventually, you could still notice a lower edge of the liver that was a little blunted compared to what you'd usually find. And this is the experience where you'll find it's not quite the same as usual, Indeed, here we have a rounding off that starts with the liver. It's normal, She's a patient who's still obese after all. The main bile duct was unremarkable. It was visible in front of the portal trunk and particularly fine, so no abnormalities there either. Where things get interesting, and we suspected this from the clinical examination, well, it's when we scan his gallbladder. You can see that as soon as we perform our classic vesicle study slice, well, we notice a large shadow cone behind the vesicle, as well as hyperechoic images within the vesicle that appear likely to be multiple. And so here we have an impurated gallbladder presenting with the presence of several lithiases within this gallbladder. So, we already have our first good confirmation on our diagnostic hypothesis. Here you can see a section that has been made to highlight lithiasis. Lithiasis globally, we'll say centimetric. We've got at least one lithiasis here, a second here, a third here, probably microlithiasis here. And then notice here the very important shadow cone that will totally prevent us from studying the posterior part of the vesicle, which is often the case in multiple lithiasis like this due to the shadow cone. But we could go further in this analysis and not stop by saying, listen madam. Indeed, you have lithiasis in your gallbladder. And I'll rerun the video we saw just before. Now notice the appearance of the gallbladder wall. And that's something that caught my eye immediately. We'll say that lithiasis is the tree that masks the forest. But let's not forget to study the bladder wall too. You can see that it's not very echogenic. It's not very echogenic and it looks thick overall. Thicker at any rate than normal. I've included a normal blister later in the slideshow for comparison. So let's go a little shallower and take a more intense interest, shall we say, in the anterior wall of our vesicle. And notice in front of the lithiasis a little bit this typical aspect, this three-layered laminated aspect of the vesicle, which seems thickened, and then this lack of echogenicity compared to the scan usually performed on a fasting patient's vesicle. Here, the patient was fasting following our request, We're going to zoom in on this vesicle and look at how clearly we can see the layered appearance of this vesicle with a hyperechoic layer, a second hypoechoic layer, a third hyperechoic layer, and this on the, shall we say, enterolateral part, but also here, the anterior part of the gallbladder. This aspect would probably have been present on the whole blister, but I told you because of the shadow cone, we couldn't analyze the posterior part. So we've got a vesicle that looks not very echogenic and that looks thickened, that looks flaky. We'll measure it. And I'd like to remind you that the maximum measurement of a gallbladder on a fasting patient or a female patient is 3 millimeters. Here we have confirmation of a discrete, albeit present, thickening. Let's not forget that the boundaries have been determined to be a token of normality or not. Try to have something binary, because ultrasound isn't always easy. Here, over 3 millimeters, even if we're slightly over 3 millimeters, we'll still consider that we have a thickening of the gallbladder. Especially as the overall look has changed. See on the right a standard vesicle, classic, normal with a lithiasis vesicle, anechogenic contents, and a well-echogenic, well-visible single and linear wall. On the other side, here you have a lithiasis vesicle. But so, notice carefully and above all, compare the right and left with here a beautiful laminated appearance, a distinctly less echogenic wall appearance overall, and thickening. Obviously, here the wall had been measured at 1.5 millimeters. It doesn't show because I cut the image, but here 3.6 millimeters. So you can see that overall we still have a much more echogenic and thinner wall, and so we have confirmation on this image of the thickening of the gallbladder, which obviously suggests chronic cholecystitis on the presence of vesicular lithiasis. We're going to put the starter video back on, and now you're going to focus on what that vesicular wall looks like. I think that's all you see now. And with experience, you'll quickly spot little signs like this. You're going to put in the probe, you're going to say, well, okay, there's lithiasis. Well, I'm used to seeing it, but the wall doesn't look normal to me. And so you'll be thinking, thanks to this video, about decreasing your depth, zooming in, then analyzing the vesicular wall a little more finely, and keeping that 3 millimeter milestone in mind. So this patient has been referred to the surgeon for imperated gallbladder with chronic cholecystitis and is due to be managed shortly. If you like this real, authentic clinical case from real life AGP, well, feel free to put a like, subscribe to the channel, put me a comment, especially if you have any questions, don't hesitate. And then the same on Facebook, and as I'm making the video, so the introductory training is on offer, so take advantage. Get started with ultrasound too. It may seem a little daunting at first, but I guarantee you'll quickly get the hang of it. You'll quickly get the hang of it, especially with the somewhat binary measurements I've shown you, and you'll be of enormous service to your patients. See you soon on EchoMap. Bye-bye.